OKB Hope Foundation is aimed at bringing healthcare closer to the doorsteps of its communities around and also underserved communities through quality and then accessible and affordable healthcare services. I joined OKB Hope Foundation to bring hope and life to people who can't afford, to people underserved communities who find it very hard to access healthcare services within their community. Access to healthcare is an essential factor or contributor to good health and well-being. People travel miles away just to get health services. So it is our hope that in the few years to come, we'll be able to acquire more mobile vans to be able to bring healthcare closer to the doorsteps of these people in the communities and wherever they find themselves.
My name is Dr. Hamza Al-Hassan. I am the medical laboratory scientist in charge of the OKB health van and the lab as well.
My name is Erica JC. I'm the nurse for OKB Hope Foundation.
Okay, I'm Kwame Dubuampong. I'm the operation manager or the officer for OKB Hope Foundation.
I joined OKB because of its initiative to bring healthcare to people's doorsteps. So I also wanted to be part of this initiative in bringing healthcare, quality healthcare to people who are unable to access this quality healthcare.
Basically what we do is that we carry out the lab tests that are being requested by our team in helping out carry out proper diagnostic care.
Okay, the operation manager or officer for OKB Hope Foundation, making sure that our operations are going on well, smoothly, mostly in Ghana and mostly in the rural areas in Ghana. For the past year, we've been with OKB and we've worked in so many rural areas. In fact, there are some of the rural areas that we don't even know they were part of Ghanaian society. But I mean, working with OKB have also opened up my mind to see that there are so many deprived areas that we need to work and we need to help. Because these deprived areas are deprived of health services and therefore they find it very difficult when accessing health services.
Since the launch of the Hope Health Initiative, we've provided direct care to over 3,000 people across 32 rural communities. We've trained 20 rural community members to serve as health advocates in their communities. These volunteers can provide early screenings and also health educations to their fellow community members. We've provided mental health education and resources to over 800 high school students.
So one of the few challenges we face as an organization is transportation. Basically, sometimes the road leading to some underserved communities are in bad condition, and as such, we find it very difficult, I mean, most often to get to these areas. And also, secondly, language barrier is also another challenge that we often face. There's sometimes challenge with they understanding our language, and so far throughout this year, these are the main challenges that as an organization we have faced.
Since joining OKB, it has been, well, I would not describe them as challenges though, but as motivations.
We face a lot of challenges.
Usually what happens is that we set out to go on healthcare delivery, most of the times in these remote areas.
Traveling to villages with poor road networks and our cars getting stuck.
So at a point in time, you find yourself starting to find your way through. It could be the car is stuck in the mud, or there's no road for you to pass through. It could be dark in the night. You don't know where you are going to. Sometimes we get lost though, and we would have to rely on this internet access. There are places where you go and there's no network, so you find yourself wondering what you would want to do.
Language barriers. So, but with all these challenges, I think we are able to overcome them.
OKB Foundation. Jamu ya na buaye pa because me kwa na minim se me yale we ya na sese. Enso mama hu yale a ewo me ho. Ti mi da mo ase. Mo kwaso a na mo nye.
Na obi won kra na onim ne blood group. Nti ebe mo ye hu. Obi a na pomuden se bi esitie.
Ja ye fie na ete se omo na wo se omo ye check up free. Le da ye baaye na nyame adom e baaye so ye nti wona minim se me wo pressure minim se me wo yale mfi ba ha no mo ye me check up free check up mo ye me bebre kwa enu bi eni wono ma se bi o mo diska kwa mo ama menhu yale e wo me so mo ama me ndro bebre
so mo de me baaye na mi ba no mo nyina ya a me baaye na ma fam free man jumi hwe man ska me gina ha na beta mo ase se ma afro pantin adika abaduru ha aba hwe me ni mba ni nyina free
doctors am be hwe mo da roma ya da mo ase se mo aba na mo be hwe na mo be ye nkyerɛkyerɛ ma ye hu se ya le se ni na wo ye ho mo a kyerɛ so mo ama ye nu e ya da mo ase.
We couldn't have achieved this without the dedication and the commitment of the Hope Health team and the guidance and support from our board members, donors, and supporters.
I see a very bright and big future for OKB Hope Foundation.
There are so many organizations that sprang up and they couldn't even get to where we have gotten to so far. We are just a year old and I can say we are doing better for ourselves. I think that in about 5 years' time to come, we should see OKB as a very big non-profit organization as it is. We are also praying and hoping that we'll be able to extend our health services beyond the Ashanti region, because I can say that there are also other communities that requires our help that are not within the Ashanti region. So what I would say is that I think in 5 years to come, we want to be able to expand beyond, to be able to offer all other health delivery services that we can be able to offer.
In the next year or two, be able to expand, and also we have 2 or 3 vans that will be running across the nation and providing health care to people.
We also hope that we have several branches across Ghana and also in Africa at large.
Next health screening, we expect to say environment nebe kesiye. If you say nipa ba na eba, obi ati ye no bi eba. The next one, environment ni kesiya, nipa ba umbenya baby atina.
We want to serve humanity. We want everyone to receive what we all receive. no partiality, no division.
We are really excited and optimistic about the future, but I must admit, it's going to take a lot of work. However, we will not rest until a mother, a father, and a child have access to healthcare.